event. And what you can see from this comparison to historical control is, in this study, that there's no full it's not full preventive. Patients, even though they have Lorenz's oil, will get disease, but it will start later, significantly later, and it will maybe not so much, at least in the US group, it's better than the historical control groups in this study. So this is a first hint that there may be some effect on the treatment with Lorenz's oil once you start the treatment, but you don't have any symptoms or very early. So, and this is the second result from this study. Again, if the curve comes down, you see this means that there is an onset of disease. And here you can see two groups. One group with normalizing Lorenz's oil, and this no normalization with Lorenz's oil. And you see, again, here's a big difference, clinical-wise, in terms of onset of symptoms. And this is a significant difference. But also, there is a significant difference in the onset of MRI changes, which are blinded results. These are blinded results, showing that those who are on treatment with Lorenz's oil do get less symptoms than onset of symptoms than those who are not on the treatment with Lorenz's oil. So this is a controlled study, but it's not a blinded study. It's an open, controlled study, and the first idea that there may be a difference if you take Lorenz's oil versus not taking Lorenz's oil. So the conclusion from this study from Hugo Moser was that Lorenz's oil therapy is neurologically uninvolved boys with ALD who are less than 6 years old delays the onset of neurological and MRI abnormalities, provided that it is accompanied by a substantial and prolonged lowering of plasma very long-chain fatty acids. The second study is our own experience in AMN patients. We included in this study only patients with pure AMN, so they don't have any kind of brain involvement. And what we do is that we calculate in the first, in this patients group of 50 patients, a progression rate before treatment. So we have a history of all these 50 patients and shown how do they progress over time without any treatment. Yeah. So, and then we compared this period of untreated progression to the same period of time when we start with the treatment. So we wanted to have a minimum treatment of 2 years and a treatment period of 5 years. The protocol, they need to have a low diet, they had to, a low C26 diet, they have a Lorenz's oil in this dosage, and so we have monthly measures with this treatment, and we saw the patients every year doing clinical MRI, neurophysiology, and neuropsychology testing. So what you see here is a progression of the 50 patients before treatment over 13 years. It's a period of 13 years. And what you see here, there's a linear progression over time. So all of these patients, that's maybe your experience as well, are progressing over time, slowly progressing over time. There are no relapses, there's a chronic progression over time. But you also can see that there are patients who are very slowly progressing and patients who are more quickly progressing. But the mean progression is using a specific score for ALD patients in adulthood. Then you can see that over a period of 14 years, most patients need some assistance with walking. They have walking sticks after 14 years of illness. There are a few patients in the wheelchair, but other patients are still walking. But this is the natural history in these 50 patients over a period of 14 years. Then we started treatment, and that was here, and this is a mean change of a neurological score. So if there are changes, it should go up. If it's getting worse, or it should go down in this curve if it's getting better. And what you see here, we started in this treatment as 44 patients over time, and followed them up to 13 years, but it's only one patient here. You see the most patients we had here 3 years, 4 years, and so on. You can see that here. And what you see is that over time, over long periods of time, there is still a slight progression, but only a very slight progression. There's much less progression with treatment, with Leukodystrophy oil, than without treatment in the same patient group of 50 patients.
Was 4 their baseline? 4?
Huh?
4 is the baseline?
Yeah, that's a baseline, the mean. They started with the ASES of 4.5. And yeah, I mean, you cannot count this, but let's say 10 years later, they are still the same.
So on the slide before, the baseline was lower?
No.
No, or that's just change?
This is the same group of patients we started here, somewhere here.
I see.
Yep. So this Leukodystrophy treatment, in summary, I would say, it makes some effect on the clinical course. It's not fully preventive, but it makes some effect. So this Leukodystrophy treatment, we had to stop it because the health insurers are not paying for it anymore, and that's and we saw that's what the time when we started was the bone marrow transplantation, because 2 years later I saw more and more patients going to to cerebral inflammation. So together with the Leukodystrophy treatment, we also providing a dietary treatment. You see here what is in this dietary treatment. I don't want to go through all this. Maybe you can read it on your papers. But you see here there's a fatty, the fat contents of this dietary treatment, the protein contents and the carbohydrates. These are suggestions that are currently under investigation. We've made the experience that patients are confused what diet they should take. Yeah, and it's in many countries there are different recommendations. And I asked the German parent organization to support a project that we gather the experience of dietary treatment from all groups worldwide. So we will contact you also for your recommendations, and we're trying to find a common recommendation, which we then maybe may have in different languages and provide to patients. So we have a common recommendation on the dietary treatment. This is too complicated for most of the patients, so we need a very simple brochure showing how can we manage with the dietary treatment, so that everybody of you can use this or not use this. But what we've seen is that using this diet, we can also lower the long-chain fatty acids. This is our normal range here. You see here that the green ones are those with Leukodystrophy oil. They are usually normal, but also with the diet alone, you can reduce long-chain fatty acids. Just with the diet, it's possible, but they're usually not constantly normal. So we need, in addition to this new dietary treatment, we need a little bit of Leukodystrophy oil to normalize long-chain fatty acids. But what we see is that the dosage of Leukodystrophy oil is using the new diet, can be reduced significantly from larger amounts to very small amounts of Leukodystrophy oil. Here are two examples. You see the Leukodystrophy oil dosage here. We stopped it here in these patients, but long-chain fatty acids going up very quickly. It's better to taper it a little bit more slightly, that your long-chain fatty acids remained normal, like in this example in the second patient here. These are just two examples how we manage it, that we combine this dietary treatment with Lorenz's oil dosage. And usually, using the new diet, we only need 10 to 20 milliliters a day with Lorenz's oil, so this is sometimes affordable. So what can you take home from my talk? Well, I think that normalization of long-chain fatty acids really appears to me as a basic therapeutic principle in all ALD patients to prevent neurodegeneration. Diet and Lorenz's oil treatment, or let's say any other strategy for normalizing long-chain fatty acids, are applicable. You can do that with this strategy in 4 to 6 weeks. And for me, the preclinical animal data, for example, the cell data, but also the clinical data, for me are highly suggestive in favor of a dietary treatment. However, we still don't have a randomized controlled trial, and I think this is very difficult. But dietary treatment is clearly not fully preventive. It's part of a whole treatment concept in ALD treatment. For me, it's a basic treatment. It doesn't make sense to treat with any antioxidative stress therapies, not taking away the reason for this oxidative stress. So I recommend to have this dietary treatment in all patients, but it's not fully preventive, you must know that. But it is something that you can do, and you can influence your own situation by using this diet. And I understand it's difficult to perform a diet. It's easier just to take a pill. Yeah. But it's your life, it's your body, it's your disease, and it's a metabolic disease with elevated long-chain fatty acids that are toxic. And you can do something to change this. Thank you.